Okay, welcome everyone. So excited to have you here for our very final session for the day, giving everyone a chance to just get into the space, get comfortable, get situated. What an amazing day. I personally am so inspired and so grateful to be here with everyone. Um, so welcome again to our plenary session, Political Advocacy for Borderline Personality Disorder, a roundtable discussion. We're so delighted you could join us today, and we hope you've had a wonderful day of connection, of learning, and inspiration. My name is Paula Zaremba, and I will be moderating the panel and the session today as a volunteer for Emotions Matter. Thank you for being here. I'm personally so glad to be here and to have found community with you all. While I'm covering introduction information, we invite you to write in the chat where you are joining us from today. So you all know us, you know our organization, Emotions Matter. We're a 501c3 nonprofit organization founded in 2015 to support, educate, and advocate for those impacted by borderline personality disorder, or BPD. And I'm just going to confirm that we are all set. Sorry, just one second. Before I move on, our broadcast should be working for those of you who can hear me. So please do let me know if there's an issue. Okay, so our guidelines for community engagement. So please enter questions during our session using the Q&A box, not the chat. Comments can be made in our chat box. Use respectful language in the session chat. Any inappropriate messaging, including harassment, bullying, or monopolizing the chat, will be deleted. We accept difference and promote acceptance, especially with regards to gender, sexual orientation, identity, race, ethnicity, age, religion, disability, or politics. Avoid explicit expressions of self-harm or trauma, which may be upsetting to others. Panels and plenary sessions will be recorded and available after the conference. No screenshots or recording on personal devices. Safety guideline and disclaimer: if at any time during BPD Fest you find yourself overwhelmed, struggling, or for any reason in need of support, we encourage you to reach out to your support system. Audience members may experience intense and painful emotions, feelings, memories, thoughts, and/or reactions to content shared. Participate at your own risk. You are also welcome to take a break from BPD Fest 2022 at any time or withdraw from it entirely. In the event of a medical, including mental health emergency, please seek care through a doctor, hospital, or emergency call number, such as 911 in the US immediately. Okay. And I'm going to stop sharing my screen so that we can introduce our esteemed speaker for today. At this time, I'd like to introduce our guest speaker, Rita Brown. We will first hear from Rita about some incredible work and advancements in Australia to support persons with lived experience of BPD. Later in this session, we'll have a roundtable discussion, and we'll feature additional guest speakers who I will introduce. So thank you, Rita, for being here with us and so early in the morning for you in Australia. I'll now turn it over to you for your presentation.
So thanks, Paula. And also, Paula, I joined in little bits of the day, and it looks like it's been a fantastic day so far. I'd just like to briefly introduce myself. So my name's Rita Brown. I am in this space because I support a family member with BPD. I am also now employed in the BPD sector, working as a carer consultant in a tertiary personality disorder service. So I'd just like to now share my screen and start off by acknowledging a tradition in Australia is to acknowledge the traditional owners of the lands on which we meet. And I would like to pay my respects to the local traditional custodians of the land on which I live, work and play. which is the Wurundjeri people of the Kulin Nation, and also acknowledge the lands of all First Nations people from across the globe that you may be on. We pay our respect to their elders, past, present, and emerging. We also acknowledge lived experience. So we acknowledge people with lived experience of mental ill health and recovery, and the experiences of those who support them, carers, families, and supporters. The voices of people with lived experience informs our work. We recognise the vital contribution of lived experience at all levels and value the courage of those who share these unique perspectives for the purposes of learning and growing together to achieve better outcomes for all. So just a quick introduction to the Australian BPD Foundation, which was formed in 2013. It's the peak body for personality disorder in Australia. We are a group of volunteers passionate in developing an open dialogue between consumers, carers, clinicians, and researchers to encourage a positive culture around what many clinicians diagnose as BPD and promoting the ready availability and accessibility of appropriate services for everyone impacted by BPD. We are registered as a national charity in Australia. I'd just like to digress a little moment here and like to highlight that the mental health system in Australia is quite different to the system in the States, and it also varies between the states. I live in Victoria, one of the southernmost states, and I plan to be speaking quite generically today. So both our federal and state governments fund different aspects of our healthcare. In addition, we have the private sector and the insurance company, and a fair bit of passing the buck of saying it's not our role, so speak to somebody else. So just looking quickly at the origins of BPD Awareness Week. So advocacy by consumers, carers and clinicians led to the Australian Senate proclaiming BPD Awareness Day as the 5th of October in 2011. And in 2014, the day was extended to become BPD Awareness Week. It was decided that a conference was the first priority, and this is when I became involved in what was later to morph into the foundation. We have held an annual conference since, except for the last 2 years due to the challenges of COVID, when the Awareness Week activities and the conference have largely merged into a series of presentations and events during the week. Those states not experiencing lockdowns have run smaller local events. In 2016, a group of individuals and organisations collaborated to create a website as an enduring platform for the Australian BPD community. In 2017, the Foundation officially took over the role of coordinating this group to promote awareness and to work towards decreasing the stigma and discrimination that so much surrounds BPD. We believe we are the only country to actively run a national themed campaign. In 2018, we were approached by Marley Jewell. Marley is a national advocate, graphic designer, and art therapist. She lives with BPD, complex PTSD, dissociative disorder, fibromyalgia, and both acquired and traumatic brain injuries sustained during childhood and her adulthood. And I certainly wish to acknowledge and really respect her tremendous contributions to our campaigns. So Marley presented us with an idea for an anti-stigma campaign, which we felt aligned very well as a campaign for Awareness Week. We know that stigma facing people living with BPD is real. Research tells us that although attitudes are changing, there are still significant barriers in place for people that are connected to stigmatizing and discriminatory ways of thinking about and understanding BPD. This leads to reduced access to appropriate treatment, specialist clinicians, and poor treatment outcomes. All of these things impact the ability of people living with BPD to live their life worth living. Using co-designed frameworks of practice, we conducted open surveys from people with lived experience, those who support and care for them, and those who work with them clinically. We asked them about their experiences of stigma and discrimination and the barriers they faced from that BPD label. All three groups agreed that stigma existed within the mental health system itself and led to access difficulties. We also asked these three groups what they felt needed to change and be put in place to combat the stigma and discrimination against BPD. We wanted to know what they needed the campaign to focus on. We received over 200 responses. Right at the top of the list was education and awareness. They wanted more information into the realities of BPD, including its diagnostic criteria, symptoms, and evidence-based specialist treatments. This information needed to be told clearly and simply and allow the voices of experts, both who have a lived experience and those who are academically resourced, to be finally heard. In 2018, the No BPD, No Stigma campaign was designed to educate and demystify BPD. It aimed to replace negative, dominant clinical narratives with evidence-based expert information and encourage understanding and empathy through listening and through learning and listening. The approach we took was non-punitive and compassionate. We wanted to engage with the people who had been perpetuating the stigma, mental health educators and clinicians, in strengths-based ways that encourage them to become learners and listeners. Our colour theory and typography is deliberately warm, colourful and diverse. We converted clinical diagnostic information into quick, easy to access graphics that were pleasing to look at and non-threatening. We used the expertise and stories from people with lived experience and their support system and amplified their voices, which has been painfully silent for decades. We aim to bring the community of those living with BPD together and tell stories of hope and well-being. We worked in partnership and collaboration to strengthen the work of the specialist BPD services and research organisations around the country, creating graphics from their resources that would attract positive attention and encourage dissemination. We made available accessible and free resources like postcards, posters, and fact sheets, all aimed at making the true narratives of BPD and the research surrounding it visible in services across Australia. So that campaign created a groundswell of those within the BPD community and was engaged with readily. One of our graphics was shared over 2 million times. Others were found displayed in psychiatric services in the UK and Canada. The reaction was overwhelmingly positive, and it kick-started that conversation that was long overdue. In 2019, the collaboration group chose the theme BPD Best Practice Deserved, giving the acronym of BPD a new meaning. In 2012, the National Medical Health and Research Council developed clinical guidelines for the management of BPD. Unfortunately, to date, these have been poorly implemented, so our aim was to provide the information in an easily understood and accessible way. The Best Practice Deserved campaign acknowledged these exceptional guidelines and uses a strengths-based approach to embed these and other evidence-based practices into the treatment structures of services working with people living with BPD. On the screen are some of the images we created to highlight facts taken directly from the clinical practice guidelines. Their campaign aimed to be informative as well as educational, to enable clinicians to grab some of the key messages without having to read a hefty tome. In 2019, we also increased the vibrancy of the colours to strengthen and draw attention to our message, and use brackets as visual language to pull out these key messages and directives from the guidelines. We truly believe that education leads to understanding. With understanding comes compassion, and compassion leads to empathy. Once people know and understand the facts about BPD and see the complex human beings behind it, we feel this will help to decrease the stigma and end discrimination. This campaign also uses the strong voices of lived experience, promoting recovery, positivity, and hope. Marley developed a series of postcards, some of which are here, and social media tiles, which we distributed widely. Flipping the script, changing the narrative of BPD was a campaign focus in 2020. I feel that this has been our most successful campaign to date. Marley developed a series of resources to challenge many of the pejorative phrases you so often hear about BPD and reframed these using a strength-based approach. In addition, Marley developed a narrative art therapy program using strength-based reframes, and you can see some of them on this slide. So instead of thinking of somebody as being clingy or yourself as being clingy, I encourage you to reframe that to think of being, they're loyal. And we know that people with BPD are very loyal to people that they care about. We ask for contributions from others, and these were uploaded to our website. This is one of my favorites. So this is using the Japanese art form of kintsugi and reframing the negative terms of fractured, broken, damaged, defective, to positive terms of flawsome, unique, helpful, survivor, and so on. And having spoken to this person, this activity actually helped her to work through a lot of her own perceptions of herself. Last year's campaign, Discover Creative Wellbeing, aimed to fill a perceived gap in treatment programs where a person's complex sense of self, self-stigma, and negative self-narrative is often overlooked. It had a three-pronged approach, and once again, Marley developed a variety of self-care resources highlighting creativity. So firstly, for people experiencing BPD, promoting the access to creative methods of expression and communication, supporting visual and audio practices, peer support, and thinking outside that standard verbal therapy box. For supporters, carers, families, how can they encourage and instill more creative thinking and ways to approach well-being, both for themselves and for those that they support? So these are just, once again, some of the many slides that Marley created, encouraging self-care, expression, and communication in creative ways: songwriting, music, poetry, letter and journal writing, and non-verbal communication. And the recognition of the importance and value of peer support is rapidly expanding in Australia. For those working with people living with BPD, I urge them to consider a paradigm shift. If the care you are providing appears not to be helping, this does not mean that the person is non-compliant or treatment resistant. It means that what you're offering is not suitable for that person. I encourage services and healthcare providers to consider what they are currently offering, and that's usually the standard 2 chairs in a room and verbal therapy box, and develop ways to respond creatively with a greater emphasis on developing an approach which supports positive therapeutic relationships. We have chosen the theme for this year for BPD Awareness Week, BPD See the Person. We are all human with all different labels, always human first. We share the same basic needs and wants to be treated with respect, dignity, and integrity. We all have a desire and need to be safe, dream, and have a future where we are valued as ourselves and to be able to contribute to society. The label or disability does not define us as individuals. And we also plan to be touching on the increasing recognition of the interplay of neuro and gender diversity for people with BPD. So our initial planning has looked at developing a series of audio-video clips aimed at normalising BPD, encouraging people to contribute an image, and this is just one that I've made up, encouraging people to contribute an image, for example, a picture of a dog and a short statement, something, my dog Frankie. He's always pleased to see me when I come home and snuggles up to me on the couch. He encourages me to go on walks and get some fresh air and sunshine and feel the wind in my hair. And I live with BPD and maybe chronic fatigue or autism or whatever it may be the case. We're encouraging people to use just their first name, initials, anonymous, or whatever. We're planning to steer away from people actually sending their images because we're aware of the stigma and discrimination and unfortunately the trolling that can so often happen when people post their images. So I know so far I've spoken mainly about our Awareness Week campaigns. However, this has only been a small part of our work. So over the last 3 years, in partnership with other services, we've developed a national training strategy and rolled it out across Australia. And this training strategy is based on the common factors approach of what we know works for people with BPD. It's similar to John Gunderson's Good Psychiatric Model. The project is unfortunately finishing next month, and we're trying to receive ongoing funding. We've started providing professional development to various organisations, and we generally provide this in a team of 3 to stay representative of our aim of representing the lived experience, consumer, carer, and clinician voices. And as well, we try and present as many conferences as we can because we feel that that's where the word really gets sent out. Our posters that you saw earlier have been displayed in the training sessions, and I've heard from some of the trainers that some of the posters have really been aha moments for the clinicians attending. In November 2019, the Australian BPD, skipped a slide. Most of our information is available via our website and social media. We send out a monthly e-bulletin with links to items of interest and a comprehensive listing of training, workshop, resources, etc. for consumers, carers and clinicians to nearly 2,000 subscribers per month. In addition, we aim to publish a quarterly newsletter, the BPD Advocate, which has more in-depth articles in a newsletter format. Subscription and membership of the foundation is free, and you're certainly welcome to join. In November 2019, the foundation invited stakeholders and those with lived experience, consumers and carers, to a forum to participate in the development of a national BPD consensus statement by, with and for people impacted by BPD. The draft was sent out for broad consultation and finalised in 2021. It's been endorsed by many organisations in the Australian mental health sector, and we present it to our Federal Minister for Health and continue to present it at every opportunity. Australia has a federal election next weekend, and we're using the statement as a basis for a simple election campaign. We are asking our members and friends to send the statement to their local candidates and encouraging them to sign. Post-election, we'll be targeting the new government and increasing our advocacy. A small and yet I think a very important role we play is when BPD is being misrepresented by the media, as is currently happening in the States with the Heard Depp case, and to use this opportunity to educate the media and to advocate for busting some of the myths and hopefully getting other stories published as well. We've also challenged the content published in a textbook and the curriculum of a university course. We have presented to various Royal Commissions, the Victorian Royal Commission into Mental Health, and also the Productivity Commission into Mental Health, the Aged Care Commission, and to numerous consultations. As I wrap up, I'd like to say thank you all for listening and to thank Emotions Matter and the team, and especially Paula, for this opportunity to present to you today. If you're interested, you're welcome to sign up for our e-bulletin and access all our resources on our website and social media. I hope that we can continue this collaboration. Together, we are stronger than stigma. So thank you, everybody.
Wow, thank you so much, Rita. I'm definitely taking that in. I look forward to reviewing the recording as well. At this time, I'd like to take a chance to go ahead and read your bio, along with introducing you, Dr. Rosa Novini, for some commentary on Rita's amazing presentation. And then we'll get into our roundtable discussion. And Rita, my apologies for not introducing you before, but so our group knows Rita Brown is a volunteer and the current president of the Australian BPD Foundation. She is a passionate state and national advocate, drawing on her lived experience as a family member of someone with BPD to advocate for the needs of families and friends, while also remaining sensitive to the needs of people with BPD, clinicians, and other workers. Rita is currently also the career consultant at a specialist personality disorder service in Australia and has presented in numerous conferences and contributed to various papers and publications. She has recently joined the inaugural board of the AART-PD, the Australasian chapter of International Society of the Study of Personality Disorders, ISSPD, as the lived experience representative. Thank you again, Rita, for being with us. And I'd like to introduce Dr. Rosa Novini. Rosa Novini is the co-founder and now board member of Emotions Matter. She's excited to be participating in this event as she believes education and community are the best ways to raise awareness for BPD. Thank you so much for joining us, Dr. Novini, and I invite you to share some commentary and reflections. Thank you.
Thank you so much, Paula. And Rita, I am so impressed and I applaud you and your organization for the amazing, impactful work that you're doing in Australia. You know, we have so much of the same ethos and values that Emotions Matter, and I think we're on similar paths and doing slightly different things and a lot of similar things. So my journey with advocacy really began after I became more educated about my loved one's borderline personality disorder. Before we actually got a diagnosis, we were kind of like everyone else. You know, she was in and out of the hospital, and people didn't want to diagnose her, and it was so difficult. And myself, I am a physician, so I've been through medical training, medical school, and my education on borderline personality disorder was literally 2 or 3 slides, and it was very stigma loaded, like black and white thinking, explosive, impulsive, and it really didn't speak to the truth of the disorder. And so, you know, I spent many years asking every single person I trained under about different characteristics that my loved one was experiencing. And nobody really said this could be borderline personality disorder, even though she was classic. The symptoms were classic. So um, ultimately, she was hospitalized and we got a diagnosis. And that's when everything started changing. And when Rita was speaking about education, I think it's very pivotal in understanding and destigmatizing and also furthering advocacy. Because when people don't know what's really going on pathophysiologically and just personally for people that are experiencing this, there's no way they can understand and advocate for and be an ally. So when Paula and I and my sister, we've co-founded Emotions Matter, one of our biggest initiatives was education. And I could not get enough education on BPD. I attended all the conferences that were available in the tri-state area. And every single conference was more enlightening than the next. And I was really able to understand my loved one and communicate with her in a much better way. And our relationship has really flourished, and she's done really well because of it. And I really think that if we didn't have the education, that we wouldn't be where we were today. And so with that, one of my biggest initiatives with Emotions Matter was to create very quick, easy to understand information bites. And some of the things I've done is some short videos, like 10-minute videos, 5-minute videos, something that everybody can understand, not just clinicians, but the average person. And I find that those living with BPD also struggle with articulating what they're experiencing, what this is. It's a bunch of criteria, and 5 out of 9 criteria have to be met. And to know all of that, it's very technical, but it doesn't have to be that way. And so at Emotions Matter, we try to be a conduit to fostering education in an easier way. And it's really gone a long way. Since I've been advocating, I've been speaking to a lot of people, and most people that I speak to, I would say 9 out of 10 they end up telling me, oh, I know someone, a family member, a friend, someone in their network has it. And so I feel that it is our duty as those that have the tools to speak about it and advocate as much as possible. And with regards to the stigma, I think, Rita, you guys have done a lot of amazing work around that, and you have big campaigns on a national level. And I was just wondering, did you hit a lot of resistance when you were developing your campaigns? And do you have any advice for all of us that are kind of in the trenches and trying to make things work out?
I guess that's a good question. We've certainly hit resistance with clinicians.
Mm-hmm.
We've hit resistance with organisations, but it's been so embraced by the lived experience community. And on a political level, it's very, very challenging to get traction with politicians. Mm-hmm. And I think it's just a case of, unfortunately, having to hang in there for the long haul and keep going that drip feed of, challenging statements, phrases, whatever it is.
Right. Did you all publish anything in major newspapers and things like that to try to get the word out more?
We approached the media and have had limited success, very limited. We just tend to get 1 or 2 articles a year. One thing that a board member from South Australia tried last year was to get the lights of their convention centre lit up in purple for beginning of BPD Awareness Week. So I would think that would gather a fair bit of attention.
That's wonderful.
And I'm sure you have the same challenge. Financial resources are really difficult.
Yeah, it's unbelievable. And despite we have several public figures that have come out with their diagnosis, and every time one person comes out, we think, okay, this is going to be the time when we get a lot of traction and people start understanding. But it's unbelievable how small of an impact it actually makes.
Yeah.
But then the negative news makes a huge impact. And we're feeling the backlashes right now of some media stuff that's going on. And it's very hard. I find that we have to keep going. I think everybody can do something, even if it's an expression of art. I just moderated a panel with some artists that have lived experience, and each of them had a different art form expression. And one of them was a poet, the other one was a blogger, and the other one was actually did 3D art. And they each said that a lot of times they have a difficult time expressing what they feel, but art makes it a lot easier to articulate it. And so I think when we're advocating, we can choose different mediums to advocate. We can create art, we can write an article, we can go on Capitol Hill. But I think each of us can do something, or we can even just talk to someone about it, right? Just like a few
Definitely.
that we meet. And that's what I try to do individually, and then with Emotions Matter. And we are making headway. I think we have a long road ahead, but not to be discouraged, because we have now created a conference and we have a walk coming up, and all of these things create bigger and bigger communities and bring us together as a bigger force.
And I think, certainly the political advocacy is important, but even if we can encourage people to reframe their own sense of self, I
Right.
think that that's a really valuable step.
Yeah, exactly.
Thank you both so much, Rosa. That was so well said, Dr. Nuvini. I really appreciate it. Was there anything else you wanted to add? I know you do have to go in a few minutes here.
No, I think I just I'm really inspired by everybody that's here today, our attendees, and everybody that's been speaking publicly. I think there's always hope, and I hope that you find hope in our community, and come on our website, join any of our events. We have a Facebook group. Together we can really make a difference. Everybody can do something.
Thank you so much, Dr. Nuvini. So, so well said, so beautifully said. I know I'm walking away with that feeling and that sense, and I also got to sit in on the art session, and it was incredible. So if it is okay, I also have a few reflections I would love to share, and then Dr. Lisa Johnson, if you're on and with us, and if you'd like to share reflections, we'll also invite you to do that as well. And then we'll move into our open Q&A portion. So for our attendees, please enter in your questions through our Q&A. But I would love to just share a little bit about my connection and my involvement with Emotions Matter. So like you, Dr. Nuvini, I come to this work and this conference because I also have a loved one with lived experience of BPD. I also am a public health professional focused on the field of mental health and recovery from substance use challenges. And I'm also an adopted Latina with lived experience of mental health challenges myself. So those are some of the angles that I bring to this conversation and to this conference. And just in reflecting on the work, Rita, that you and your organizations have done, especially the BPD training for providers, a few things come to mind for me in regards to public health. So in public health, we often think about prevention of mental health health challenges, prevention of onset of symptoms, and also prevention of symptoms getting worse over time and across the lifespan. So we also think about systems level change and health of entire populations. So at the state and at the national level and at the local level. With this in mind, I'm reflecting on a few changes that I think we'd benefit from in our health system here in the US. I think about holistic care and a need for integrated care, connection and collaboration between physical health and mental health providers, especially when psychotropic medication is part of treatment. Research and evidence tells us that individuals with mental health and substance use needs have higher prevalence of preventable diseases. Persons with serious mental illness have less access to preventive care and care management of co-occurring health conditions among populations of color, among historically marginalized communities, and for those with financial barriers, this is especially true. So I think about the mind-body connection. Also when we talk about think about how trauma can manifest itself in our physical bodies. As a family member, I think about a greater expectation of working with families and caregivers. So Rita, in some of the materials you all created for training for providers, things were mentioned like family plans in times of escalating distress and importance of family skill building. And also, I recognize the importance of respecting if loved ones with lived experience of BPD do not want family members involved. So I also just think about how our family relationships have such potential to support our loved ones with BPD and their healing and our own healing as well. When learning the language of emotion regulation and dysregulation and related skills as families and siblings, we have the chance to help ourselves, our closest relationships, and our collective mental well-being of the family. So those things all very much excite me. Among communities of color specifically, when it comes to psychoeducational materials for providers or for our communities, I think about ensuring linguistic and cultural responsiveness and understanding how culture plays a role in our understandings of mental health conditions, including BPD, and talking about stigma and why there is a history of stigma specifically around mental health conditions among communities of color. It's very much a result of structural racism, and health professionals have to be careful about how we discuss this. I just loved hearing about the campaigns that you touched on, Rita, the national campaigns, and it just makes me think of the further education needed that also you, Dr. Nuvini, talked about. And I reflect on just the greater stigma of mental health challenges broadly, not just BPD, and even among health professionals. And that was discussed in the previous session on stigma, and I really appreciated that. I'm someone who has mental health challenges myself, and I still struggle with self-stigma. Much like unlearning implicit bias related to racism, to combat stigma, we have to be willing to look at ourselves and our beliefs too, and shift our mindsets. And I think that's absolutely true for those of us in public health. I also am so inspired today by all the stories that were shared. Brene Brown says stories are data with a soul, and we need more of these, especially from Black and Indigenous and people of color. And I'm not saying everyone has to share their BPD story, but for those who want to, we need your stories. Among Black and Brown people, this is especially true because we have such little representation across healthcare broadly. And we deserve to take up space and have a right to equitable and culturally responsive services. Because I'm also an adoptee, this is also true for adopted people. We need more representation of our stories. And then those of us, we can all work to create platforms for storytelling and open hearts to listen. So anyway, I really appreciate the work we do at Emotions Matter. I love that it's very much peer-led and peer-informed, much like your organization, Rita. It's clear your materials and campaigns are informed by individuals with lived experience. And I think other organizations and advocates can learn from us as far as how we honor and learn from those with lived experience of BPD. And it's not often the case across every organization. So with that, I'll go ahead and ask you, Dr. Lisa Johnson, if you have any additional comments you'd like to share. And otherwise, we can transition into our roundtable. And Rita Brown, I would love to invite you back to the screen.
Hi, Paula. Thank you for this opportunity. I had not planned ultimately to speak because I've lost access to my childcare assistance. But hearing everything on this panel and hearing you, Paula, just now talking about so many of the important things that happened today, I just want to express my gratitude for being part of it and to reflect on my own experience of constantly kind of going back and forth between a kind of feeling compelled to share BPD stories and to offer that support to the BPD community, feeling compelled toward total transparency in the service of making things nameable and visible so that they're more well understood, and balancing that with a kind of learned nervousness around what the repercussions could be, who's going to see this video, what detail is going to stand out as a sign of, my own poor judgment in sharing these details. And so I feel like my mind is wrestling over time with what we've now named today as stigma, both institutional stigma, familial stigma, and internalized stigma. And so I think that today's event just really named a central problem for our community, and I appreciate it. And it has pushed me to think both personally and professionally in sharper ways about the problem. So thank you.
Thank you so much, Dr. Johnson. And it was so nice to see your daughter in the background. So thank you for sharing, and just for sharing earlier today. I was so inspired by all the work you're doing. So Rita, I'd love to invite you back on screen. And for our participants, if you all have specific questions, please continue to enter them in our chat box. Paula, Tusiana Eng, you're also welcome to join us if you'd like to participate in our roundtable conversation. It looks like we do have a question. Is there a link or way we can review those posters from the Australian campaign? Some may be nice to have around my place and myself as a reminder.
So yes, they're all available on the BPD Awareness Week website, and I'll type the link in the chat. Will everybody get that?
Yes.
Is that the best way to do it?
Yes, everyone will see it that way. Thank you so much, Rita. Okay. Oops, sorry, I did just make sure. Dr. Nuvini had another engagement, so she had to jump off, just in case anyone was wondering. But Paula Tusiana, would you like to contribute to the conversation?
Sure, and I also want to echo what Paula said, since we're so lucky to have Rita with us. Rita and we have like a mutual adoration society where I say, I love what's going on in Australia, and she says, I love what you're doing in the States. And so we've talked for a long time about collaborating. And so it's been lovely to have you. It's late afternoon here in New York. And I know it's very early morning, 5 a.m.-ish in Australia. So I just want to start off by saying how much we appreciate you getting up early to spend some time with us in the US. And it would be great if people can acknowledge that in the chat. We recognize that, especially on a Saturday, it takes a commitment and a sacrifice from all of us just to be here today, to be able to talk about this very important topic to all of us. So continue to put any questions you might have in the chat, but just to respond to the roundtable, as Rosa said, when we founded Emotions Matter, we were very interested in political advocacy, because we felt very strongly that when we founded this organization, we did a series of about 10 focus groups. When we were trying to come up with our mission as an organization, we knew that there were other organizations that existed in the BPD space in the United States, and we didn't want to duplicate programs or services that were already being offered by other nonprofits. And so we did these focus groups over the course of about 6 months. And when we understood, based on surveying people in our community, what do you think the needs are that are not being met right now? The highest scoring things in those focus groups was no one's doing peer support, nobody is doing political advocacy, there's no treatment access, and there isn't enough research. And those were really, in terms of political advocacy, not enough research and treatment access were like the two highest things that scored. And so that's where we started as an organization in 2016. One of the first things that we did was a change.org petition advocating to the National Institute of Mental Health in Washington, D.C. and NIMH for more BPD research. And it was in March of 2016, we got 5,000 signatures on that petition in less than 6 weeks. And it led to Emotions Matter meeting with NEA BPD, with the head of NIMH in Bethesda, Maryland. And out of that meeting, a year later, NIMH put out the first ever public education brochure about BPD. So in our early years, we did get our feet wet in advocacy, and we saw that by putting pressure on the government that they would try to take some baby steps to recognize that BPD needs to be, you can't go on the federal website and not be able to find information about BPD. It's a real mental illness. It deserves to have the same recognition as schizophrenia and bipolar disorder and major depression and PTSD and, you know, all these other illnesses that get major government funding. BPD is the least funded in terms of research of all, you know, of mental illnesses that have the kind of severity of outcomes that BPD has. You know, when you have up to 10% of people diagnosed with BPD, sadly, you know, losing lives or suffering from suicide or suicidal ideation, ending lives, that's a very high mortality rate. So we should be getting funding because other disorders don't have those kind of statistics. So we were very clear in advocating that, you know, public education can save lives, and that's what a lot of the panels today have illustrated, and so we do feel like that's important. The second initiative that we undertook in our early years was also in collaboration with some other community partners. In 2016, when the 21st Century Cures Bill was being voted in Congress, we tried to get BPD listed as a serious mental illness in the bill. Other major mental disorders were listed by name, and BPD was not. We lost that campaign. But a year later, we were able to get 13 members of Congress to sign a congressional letter to try to get BPD included in the bill after the fact. We did not win that, but just getting members of Congress to sign a letter about borderline personality disorder was, as Rita said, we take baby steps. And then really in 2018 is when we started to shift our focus to raise money to launch our peer support programs. And then certainly during the pandemic, we've been all about creating programs to, you know, mitigate the social isolation during quarantine and to try to help people feel more supported. So all of our resources for the last couple of years has really gone toward peer support. But now that we are coming out of the pandemic, that is really why we were very inspired to make advocacy the theme of this conference today, is because, you know, times are changing. Yes, more and more people are living with BPD in recovery today or identify with a stage of recovery. That is a major shift in the last 10 years because people have been able to get some of these successful treatments. It doesn't mean there are not, you know, millions of people that still need access to care and are suffering. But what it means is that, you know, on social media, in the news, we are seeing more and more people that are disclosing their disorder. And so that means we have an opportunity to be able to talk about what we consider to be the real story of BPD, which is that, you know, it's more than a label. People are so incredibly talented and creative and full of so much life contributing to society that we can now be part of that conversation. That, you know, Rita talks about this incredible poster messaging campaign across the services in Australia. Isn't that a great model for something that we could aspire to here in the States, working with clinicians and agencies to do a public education campaign? So I'm so grateful to hear about the things that you've done, even clinical standards. We have APA guidelines for BPD and they're not enforced as well, and they haven't been re-updated in a long time. So we have so much to learn about the work you've done there. Some of our biggest challenges in the States, frankly, are that our health system is extremely fragmented because healthcare is not organized federally unless you're Medicare or Medicaid. In the States, our insurance is regulated by each state, and we have 50 states. So it makes healthcare very decentralized. So the number one issue that we experience at Emotions Matter when people call us is we cannot get treatment. You know, in the United States, unfortunately, there's incredible barriers, and Paula also mentioned some of those, that, you know, it's wonderful that we have some of the best researchers in the world. So many of the evidence-based treatments came from researchers in the States that have been tested here. We have some of the most brilliant scientists in the world researching BPD. However, 95% of Americans still can't get that treatment, and that's because it's not often covered by insurance companies. And that's because insurance companies also have very stigmatized views of BPD. So we've tried at Emotions Matter through our single case agreement brochure. One of the very first publications that we did, or in 2017, our first publication was utilizing single case agreements to access BPD treatment, giving people a script, because we found that when people called their insurance companies, they were talking to reps on the other end of the phone that had no idea what BPD is. They had no idea how severe it is, that you can't tell somebody in the hospital that's being discharged who has BPD with no discharge plan, no aftercare, call them back and explain that they need help and they need help now. And we found that, you know, people in the community, when you're dealing with these severe symptoms, whether you're family members or people with the disorder, could easily, I mean, I would become very dysregulated talking to somebody, to an insurance rep. It's not a fun experience. But when you have this disorder, you need help, and you need to be able to get that help now. You don't have time to sometimes wait on waiting lists for 6 months or a year. Yet that's the reality, right? So Emotions Matter exists to provide a safe haven for people when they are stuck, to get resources, to find community, to know they're not alone, to help get some real in the trenches sort of advice from peers with lived experience, from family members, so that, you know, when you're on these waiting lists or you're trying to find care, you can find real world strategies to help yourself, educate yourself, and move forward on the journey. So today, part of this conference, if you see the advocacy button over on the far left menu bar, there should be a button that says advocate. And we have created some ways that we hope you will consider getting involved after this conference. One of them is one of our advocacy volunteers, Kimberly Hickey, helped us create a Google form, because in order for us to do advocacy at the state level, we've developed a letter, an advocacy letter with some of our clinicians to the attorney generals of the states to ask them to investigate insurance companies that are denying people coverage for BPD. But we need to collect testimonials for that. And we need to hear your stories. If you've been denied treatment for BPD, please consider sharing your story with us. We won't use names, we won't disclose information, but we need real testimonials so that if we're going to help create campaigns around insurance access, that we're not just telling stories that we've heard. We can talk about real people that live in real states, and we have the name of the insurance company, and we have the actual story, because that's what matters when you're talking to politicians. You have to have a really, like, a vetted story. So there's a Google form. Please feel free to share your stories with us. The other thing we have is we'd like to start to understand, you know, where people across the country want to start to get involved in grassroots advocacy, because it really takes putting together organizing committees. And so there is a form that's a specific get involved form that invites you to sign up. Let us know if you're interested in writing letters to politicians, if you're interested in meeting other people in your community that are also interested in advocacy. If you're interested in being on a committee, like our committees that form this conference today, where we often have listening sessions where we're trying to figure out what is our strategy around advocacy. So if you're interested in getting involved in future advocacy efforts, we encourage you to fill out those forms. We have lots of other volunteer opportunities at Emotions Matter. We're run all by volunteers, but as Rita pointed out before, you know, our ability to do advocacy depends really on, well, a few factors. One of them is resources, and resources is often, you know, money, right? We need, in order to create beautiful brochures, either you have to have a fantastic volunteer like Rita has, who has the talent and the ability, or then you have to have resources to do social media, paid ads, and to print posters and to print buttons. We have also buttons at Emotions Matter. This probably looks backwards on the screen, but one of the first things we did is we have these buttons called Ask Me About BPD that we usually wear at our walk. And we've got lots of, cool swag, but it does cost money and resources. So people resources, though, are incredible. Our conference today was put together by over 50 volunteers, and I'll do thank yous in a little bit, but we need the people resources and then we need the financial resources. So I just want to, thank Rita for being with us. It's incredibly inspiring, and I feel like we love to be doing some of the work that you're doing in Australia here, and so I'm just deeply appreciative.
Thank you so much. We did have a question in the Q&A about what political advocacy is for BPD, and I feel like you just touched on so many opportunities for people to get involved. So I do hope that that question was answered very well. We've gotten some great examples from you, Rita. And looking at the time, I'd love to just ask you, Rita, if you have any final parting thoughts you'd like to share with us in the state. We have people in the States here with us. We have folks in Canada. Is there any final thoughts you'd like to share regarding political advocacy and, the work that we're trying to do on the ground?
Look, sorry, you put me on the spot. I think it's all been really well covered, actually. I'd encourage people to only advocate within their own level of comfort and capacity, but every little bit helps. And together, as I said, we're stronger than stigma. So to reach out, get the supports, and just advocate in whatever way you can, even if it might just be to a family member or someone else that you may meet in the street, a colleague or somebody.
Thank you so
much. And help
much.
people to see the person behind this label.
So beautifully said. And thank you. We look forward to working with you and just continuing to learn from the work you all are doing in Australia. I'm so excited. And I think with that, I'd just like to thank our participants for our questions during our roundtable. Thank you so much, everyone, for being with us for this wonderful session. Paula, was there anything you wanted to add before I kind of
well, we're not closing out yet. We just want to do some final thank yous to wrap up the conference. But if Rita, you need to go have like your third cup of coffee this morning in Australia, we totally understand that, and we thank you for your time.
Thanks, Paula.
Impressive. Thank you.
Thanks, Paula. Thanks, Paula. Thanks, everybody.
As we're wrapping up our conference today, I just wanted to invite our Vice President, Sarah Rosenberg, to talk about, volunteering, and then I'll just do some final thank yous for the day.
Thank you, Paula. I just want to say how grateful I am for the opportunity to work by your side, Paula, and gain inspiration and strength from everything that you do. You give your life for people affected by BPD. You've saved countless people from doing the unimaginable. I am amazed at your dedication and warmth. You are the greatest role model, and I'm honored to have this opportunity, and thank you for believing in me. I also want to thank Paula Zaremba and Dr. Lisa Johnson for helping to bring this BPD Fest together. We did it. I am so amazed at how today has gone. I think we did a great job, and I'm so proud of us. And thank you to all the attendees. I want to thank all the volunteers for giving their time to share their journey with us today. We thank you for your courage and leadership. We are always welcoming new volunteers to our family, and we have various opportunities available. I think, Paula, you mentioned that. I can tell you personally how incredibly fulfilling it is for me to volunteer at Emotions Matter. Being a peer leader and supporting others struggling like I have gives me more meaning than anything else in my life. So fill out the Get Involved form on our website to help make a difference in the lives of people affected by BPD. And then last thing I want to say is if you enjoyed today's conference, we'd love to see you at our upcoming Walk for BPD on Sunday, June 5th in New York City. This year we're doing a hybrid event, and you can walk your own way in your city and watch our live stream. We have several teams in different cities, and we'd be happy for you to create your own team too. This is a fun friends and family event, as well as an important fundraiser. Providing free conferences and programs is only possible through the generosity of our donors. By signing up for the walk, you'll receive a free Emotions Matter t-shirt, as well as other swag at the in-person events. If you haven't checked it out, we also have swag for sale at this conference, which you can find on the swag bag tab. And the donate tab is located at the top of the lobby page as well. And we need your support more than ever. Please show us your appreciation by making a donation now. Your generosity means the world to us. Thank you. And I'll turn it back to Paula.
Thank you so much, Sarah. I said this earlier this morning, and of course I want to end this to say it again, that, it's a pleasure to get up and really work every day with an incredible board. And I'm so proud that, people at BPD are in leadership in every aspect of our organization, our board chair, our board vice president, many of our committees, and so much of the work that goes behind our organization is done, by people with BPD. And that's how we also break stigma, because we know that, people with BPD are the best spokespersons to address stigma. And it's really helpful in people's recovery to feel like they're giving back and helping others on the journey. And who better to do it than people who walk the walk and who understand the journey. But we also have family members that are really, involved in our organization. Our volunteer coordinator, Melissa Ferdinando, who's another vice president that's been in our Emotions Matter booth during the day, is instrumental to our team. If you sign up to volunteer, you will meet Melissa at some point. And we also have clinicians. You heard Sarah Maslin earlier, it's Dr. Feinberg. We have a lot of clinicians that help us create our stigma-free materials. And so wherever you are in the community, if you're a healthcare professional, if you're a family member, if you have lived experience, get involved. We have about 100 volunteers around the country that make Emotions Matter happen. And every idea, including this conference, has come from our community. And so, I do mean it so sincerely when I say that, we get better because new people come to the table with ideas and have the passion and the spark, and that's what it takes. And it also takes resources. We pride ourselves on. There's been a lot of conversation today about, diversity and inclusion, and that's something we want to be working on as an organization. And in order to do that, we need more people at the table that represent diverse communities. And we pride ourselves on being able to offer all of our peer support programs at no cost to the community, because we know that people with BPD have to spend their money on treatment if they can get treatment. And so we don't want to charge people for peer support. It's sort of, that's, when people need the help, we want people to get the help, but that doesn't mean there aren't real costs associated with providing free peer support programs or free conferences like this. And so we do really depend on the donations of the community to be able to support our programs, our services, our staff. So I encourage you to make a gift if you can within your means. Form a walk team, get involved. I'm so grateful for our sponsors, especially New York Presbyterian Hospital, the Giambelli, the Francesco and Mary Giambelli Foundation, our patron sponsors, Silver Hill Hospital, McLean Hospital, the New England, the NEA BPD, so many phenomenal organizations that have shown support for the work we're doing. We couldn't do it without them as well. And there's many other sponsors that I'm sure you've seen throughout the day today. We encourage you to take a look because we're really grateful for their support. I also just want to give a shout out to, there's a lot of behind the scenes heroes that make events like this happen. Our amazing staff person, London Harp, who's been manning our phones and our emails and has done all the behind the scenes work on the platform and in the office to kind of make sure that this happened. London, we thank you, and you are such a valuable part of our team. We're also really grateful for, we have, amazing volunteers that are also, again, what I call behind the scenes heroes. Dan Hofert, who helped on our legal team to put our waivers together for this event. Angela Dimson, Linda Singer, Michelle Hillock, Ken McIntosh, John Bell, who all do IT, graphic design, social media, communications, Heather Carey on social media. So Emotions Matter is like, there's what you see on the outside, and then there's the people who are volunteering behind the scenes that actually help us to deliver these programs. They often don't get thanked, but I think it's so important because, especially with a virtual event, there's a lot of behind the scenes communications and IT, and we really depend on those people. So I thank our amazing panelists who made today possible, who showed up on a Saturday and did multiple tech training and panel prep. I thank our board members for making today possible. And I see Sarah, thank you for Sarah always being there. Are there some questions that you want me to answer from the Q&A?
Yes, I think.
Okay, let's take a look right now. Okay, so let's see. Will future BPD fests be virtual? That is such a good question, Jessica. I appreciate the question. This is our second virtual conference. We've been virtual because of the pandemic. The walk coming up on June 5th is, believe it or not, it's our first in-person event in 2.5 years. So we cannot wait to see people. It's been a long time that we've been in the virtual space. Before the pandemic, we actually had regular meetings in New York City, or peer support. Some of our peer support programs were in person. So we're really trying to figure out, from a financial and staffing viability, can we open again to be in person, or are we going to stay in the virtual space? Clearly, one of the beauties of the pandemic for us has been, it's taken us from being a more Metro New York organization to being more national in scope, and it's brought volunteers from all over the country into our organization and even internationally. So I think that, that really speaks to, as we're growing as a nonprofit, for us to continue to keep many programs in the virtual space. And we do need, obviously, volunteers and funding to be able to do that. But thanks for bringing up that question, and we hope to be able to continue to deliver conferences. And I think this has been such an amazing conference today, and it reinforces the importance of this type of dialogue. We also know, though, for some people with BPD, especially the importance of, that you can't, the virtual space is great, but we know for some people that may struggle with trust and attachment, and, that you can't really replace that in-person interaction. So we'd like to really do some in-person work again. We're just trying to figure out how and when, et cetera. So we hope you can be part of that conversation with us. Not everybody likes virtual, and we recognize that. Let's see, do you have a place for people to share testimonials of medical trauma, being mistreated by providers, psychological care? This is why we put this Google form together about treatment access. But if you have other stories and testimonials that you'd like to share with us privately, we'd really like to hear them. Honestly, it's when we hear from you that we recognize that there's really important needs in the community that are affecting people with BPD that need to be addressed. So if you've been traumatized because of stigma, and a stigmatizing reaction on the part of, healthcare professionals can be very traumatizing. In one of our first surveys that we developed at Emotions Matter, we would ask people when they left some of our programs, do you feel comfortable asking for help for your BPD symptoms? And 80% of the people would leave our program saying no. And that's actually a very frightening statistic. People with BPD who have severe symptoms should feel comfortable asking for help. And if they don't feel comfortable asking, it's usually because they've been invalidated when they've asked for help, whether it's in their environment or whether it's by healthcare professionals, and that could be very traumatizing. So if you have a story where you've been traumatized, please reach out to us. Send me a personal email. My email, I could put my email in the chat. I talk to people all the time. We want to hear your stories so that we can understand the problems better and the experiences and try to address them in the best way possible. I hope that answered your question. And resources, it's as Dr. Maslin said in the previous session, part of our work at Emotions Matter needs to be to educate clinicians and to work with clinicians who understand our mission and who want to do that very important work of addressing stigma. So, we don't want to be in a space of always attacking clinicians, because we understand that some clinicians just don't get it. But some clinicians do, and they're on our board and they're part of our work. And we want to be able to empower clinicians to get the right education so that they can help us with our advocacy. So it's a tricky thing, but we got to start somewhere. So thank you for that question. Regina, I have not heard of the film BPD and Stigma, but I know there are many films out there about BPD. And so certainly share that resource. I'm sorry, I'm having the phone ringing and I'm trying to stop it. Okay. And let's see, can you talk more about what political advocacy is for BPD? I think maybe this question came up before. You know, it's not well defined because it's a very new concept. You know, BPD as a diagnosis came into the DSM in 1980. So it's roughly 42 years old as a diagnosis. But treatments only became developed in the 1990s, and then they became available to the population in the 2000s. And a lot of the research showing that treatments had an evidence base really only happened in around 2010, like in the 2000s, in the 2010 era, is when studies began to show the efficacy of treatments, et cetera. So that's why I say that we're in this very interesting time in the history of the disorder, because it's only now in the last 10 years that there's been a lot of people, there's been people in the population that have been talking about recovery and recovery-oriented language like we do at Emotions Matter. And there's very little literature around BPD recovery. But when you have people that are able to identify with recovery, then you can start developing advocacy, because now you have people with the disorder that are beginning to develop the confidence and the ability and the support to have, like Lisa, Dr. Johnson was just saying, you know, many people with BPD struggle with being in that space of, what do I disclose? What are the risks around disclosure? Can I be an advocate? And that's where we at Emotions Matter can be an advocate. We can be advocates for you and with you and among you. Some people are not in a space where they can advocate for themselves because of stigma, and we recognize that and we honor that. We want people to feel safe. It's more important that you work on your recovery journey than you put yourself out there to be a poster child, or, you know, we don't ask that of people. We will never use your name or your picture or your testimonial without your permission. It's our policy at Emotions Matter. But if you'd like to be public, obviously we encourage that, but we look for places for people to be as safe as possible around disclosure. So can we talk more about, I think political advocacy and BPD is a very new concept in the United States. And that's why I invited Rita to come today, because they've done a lot more in Australia. I think we have so much more work to do, and I hope we can be doing that together. But political advocacy is really, in a more systemic, strategic way, addressing the discrimination that exists in our social systems and in our policies, where BPD is not being addressed or recognized. So that's in our laws, like the penal code that Dr. Maslin mentioned before. When people apply for disability, you know, their disability applications are not being accepted at the same rate as other disorders, right? If you apply for disability in this country and you put bipolar on the application, it's more likely to get, you know, gone through quickly. If you put borderline personality disorder, you could wait for 6 months or a year for that application. That's not okay. So it's more of addressing systematic discrimination that people with the disorder experience, not being able to get insurance. You know, we have laws in this country, the parity laws, which say that when you have a mental illness, you're supposed to get treated for that illness. So when I think, what is advocacy? Advocacy is developing public awareness or advocacy campaigns to address the systemic discrimination that people with BPD experience in systems that prevent them from getting the care that they need to recover. So sorry, that was a very long-winded answer to that question, but obviously it's something I'm super passionate about. Okay, so I think we answered all the questions. I'm seeing like comments in the chat. Thank you so much for being with us here today. It is just a pleasure to be part of our Emotions Matter community. We hope that this is not goodbye. We hope this is hello, and we hope to see you again. So please consider, again, making a gift, getting involved, and let's do the work together to figure out what advocacy looks like into 2022 and 2023. So we will be in touch with you if you fill out our Get Involved form for advocacy. If you fill out any volunteer forms, if you want to get involved in our walk, come meet us if you can. We will continue the conversation. So again, thank you for being here with us today, holding this space on a Saturday in May. And what a great way to be celebrating BPD Awareness Month together on this very, very important topic. Thank you so much on behalf of Emotions Matter, our board of directors. It's been a pleasure to spend time with you, and we're going to sign off. But again, we hope this is not goodbye. Take care now. Have a great afternoon and rest of the evening wherever you are.